My name is Dr. Michael Visker. I work at Alewife Brook Community Pediatrics here in Arlington. As boys start growing from children to being adolescents, a lot of things change, and they change both in their physical health but also in their mental health. One of the things we really try to focus on is having the adolescent boys really be the one who kind of voice their concerns. Part of that is having the majority of the visit with parents out of the room. And really that's just to kind of get them used to being on their own in the medical environment, being able to start developing those skills to advocate for themselves, to speak on their own behalf, as opposed to having mom or dad kind of tell the story. Really getting them to try to find their own voice and try to find a way to tell them how things are affecting them. One of the things I always tell adolescents, I call it the sex, drugs, and rock and roll questions. That usually gives kids and young adults a good idea of what's coming next, because it can be kind of shocking to have someone all of a sudden start asking about, using drugs or drinking alcohol or their sexual identity and their sexual activity. And so just kind of put people at ease and help make those conversations a lot easier. Things I always tell adolescents as they're transitioning from high school to college is, one, if they are going to school, find out where the Student Health Services Center is and really feel comfortable going to them. At the same time, we here at their primary care office are always available if they want to call and talk. I think it's very important for us to continue to see kids through their college years, so they have someone who knows who they are, knows where they come from, knows their family, that they can use either as a sounding board if they're at school and can't get back home, or if when they come home from school and on vacations and on summer break, to have their yearly checkup, to get their immunizations, and just to kind of touch base, because it is such a huge change going from high school to college, and having someone who is kind of like a familiar face, and hopefully what they consider a safe place, is really helpful for kids as they continue to grow into adulthood. So ideally, the conversations about transitioning from pediatric care to adult medicine should occur as the kids start getting to 17, 18 years old. I tell them the most important part is just finding someone you feel comfortable with, someone you feel like you can talk to. My only goal in the whole situation is really just to make sure that they're happy and healthy.